Recently, numerous cases have been reported in the media about Spaza shop owners, especially those of migrant business owners, have been reported about them selling illicit and expired goods to communities. Today, we look into this issue. We look into some of the ways that we can try and solve this issue. We have Dr. Zimba from the city of Cape Town who will be helping us discuss this issue further. He works specifically in the health department of the city of Cape Town. Thank you so much for joining us on the show. Before we get into the conversation, please don't forget to join in on our conversations on social media pages. On Instagram, we are official_Africa Unite. On Twitter, we are Africa_Unite_ZA. And on Facebook, we are Africa Unite. Let us know what you think or how you think are some of the ways that we can try and address this issue of, illicit goods and expired goods being circulated in our markets, and make sure that every single person is eating healthy food and is eating food that is of standard. Dr. Zimba, thank you so much for joining us on the show and welcome.
Thank you very much.
Now, I know you work for the city of Cape Town, the health department, health and safety department. I just wanted to check before we move on with the conversation. What is some of the work that you guys do specifically with the city of Cape Town in that specific department? What kind of work or programs do you do?
Yes, I'm in charge of primary health care services and environmental health services, working for the city of Cape Town. What's happening is that I'm in charge of a team of environmental health practitioners who were previously known as health inspectors.
Okay.
Today they are known as environmental health practitioners.
Was there a reason for the change in the name, perhaps?
Not at all, but because their work encompasses a lot also in terms of the environment. They have to encompass the entire environment. So they are more environmental health practitioners.
Okay, perfect.
Yes.
And what do they actually do?
Yes.
Now, it just in the scope of their work, what do they do in communities? What's their role? Why are they so important in our communities, and especially with the context of the issue at hand of these illicit goods and food that is not of standard? So what exactly do these health practitioners do?
Yes, although they are in charge of various environmental health issues or circumstances.
Yes.
But I will be focusing today on food safety.
Yes.
In relation to the Spaza and other formal businesses. Yeah. Before I can get to their work, I must indicate that environmental health practitioners derive their mandate from the Constitution of the Republic of South Africa, Section 24.
Oh, great.
That stipulates that everyone has got a right to an environment that is not harmful to their health or to their well-being.
Yeah.
Also, their health must be protected for the future generation, for the benefit of the future generation. Therefore, their work is precisely prevention. They are the first line of defense.
Okay.
They are deployed across the city. Number one, licensing the premises, certification of the premises, and monitoring, and also giving advice to the shop owners, to the spazas, train them, guide them in terms of the health requirements. And furthermore, they ensure that the food that is being consumed is of high standard. So that we cannot end up having food poisoning. They go to an extent of taking food samples and send them for bacteriological sampling and chemical sampling. They do that on a routine basis to safeguard the health of the community. So in terms of that, we ensure that we get better health outcomes at the end. And then, as I said, they are the first line of defense and prevention and protection.
So you mentioned quite a few things that I'd like to touch on. firstly, you mentioned that in the city of Cape Town. Does this also apply to other provinces, or is it just specific to Cape Town? For people who don't know out there, is there maybe another, for instance, for Johannesburg, do they have their own health inspectors? Say in the Eastern Cape or in a city in the Eastern Cape, do they have their own? So is it city-based or is it just the city of Cape Town?
Okay.
Because you mentioned as well it's constitutional, right?
Yes. Yes. Today, precisely, I'm here to speak about the city of Cape Town.
Yes.
That's what we are doing in terms of ensuring that we've got environmental health practitioners deployed in various areas to ensure that.
Okay.
As I said to you, the environmental health are employed in various municipalities.
Okay, perfect.
They are supposed to be. They are appointed in various municipalities.
So it's not just one area.
It's across
so everywhere in the country.
Yes,
perfect.
Because in order for us to meet the requirements of the Constitution, Section 24, environmental health is a national call.
Yeah.
It's a national imperative.
Yeah.
So therefore, they are appointed across the country.
The country, okay. So you also touched a bit on the issue of the fact that they also give advice to the shop owners. So it's not like they go out to catch people. It's them doing their job as mandated by the Constitution, like you said. But also they go there to make sure that the standards are met. Because I think the underlying understanding with people, especially shop owners, and I'm saying this based on what we've heard and encountered, is that they think maybe the city or all these other departments are there to catch them and to maybe force them to close their businesses. But it's basically to ensure that everyone is safe, right? And to ensure that, all these standards are met. So you also mentioned a very important point of giving advice. So you also basically give advice, right, to the shop owners as to how they can adhere more. Can you tell us more about that?
Yes. Basically, environmental health, they create awareness
Yes.
and educate.
Yes.
Health promotion is part and parcel of environmental health.
Yes.
So when they go, they ensure that the shop owners or the Spaza owners, they understand what is expected of them in terms of the health guidelines.
Yeah.
So we go on and train them in terms of them understanding what is expected of them so that they comply.
Yes.
So it is imperative for us to educate and advise them that in order for your shop to meet our requirements, A, B, C, D must be done in terms of the legislation.
Okay.
And we encourage them to apply for business licenses.
Yeah.
And also for certificate of acceptability. For your shop to be operational and to be of standard, they must apply for the certificate of acceptability that is issued by the environmental health practitioners.
Okay, great. Let's get more into that after the break. Please do not go away. We still have Dr. Zimba here with us. Very, very interesting information that you as well at home can also use. Please don't forget to engage with us on social media. Let us know how you think we can create more awareness about this health and safety standards as well, to work hand in hand with the city of Cape Town as well as other cities and communities. Let us know what you think on Facebook, on Twitter, and on Instagram. Please stay tuned. We'll see you after the break. And welcome back. We are still discussing some of the ways that we can use, or things that we can use, to ensure safety in the food that we eat and consume. And specifically now in relation to the recent cases of, expired foods and illicit goods that have been circulating in the South African Spaza Shop market. We're still joined here by Dr. Zimba from the city of Cape Town. He gave us very, very rich and important knowledge about the work that they do as the city to ensure that everyone is safe. Now, before we went to the break, Dr. Zimba, you mentioned something about business licenses and certificates of acceptability. Now, for instance, for people sitting out there back at home, maybe there's someone who has a Spaza shop or who's a business shop owner. What is this? What is this certificate of acceptability? What are these business licenses? And does everyone have to have it? Even if you have a small Spaza shop, I know some people even have, vendors, they just sell from their stands. So does everyone need to have it?
Yeah, a formal business must apply for a business license.
Okay.
So that they can meet the requirements. I must elaborate. Over and above environmental health requirements that we need, there are other requirements that are needed from fire department, land use.
Yeah.
All those things, they must be fair and they must be clear about them so that we ensure that the premises are safe from fire and the place where the business is being conducted is at the right place in terms of the land use. So coming to the health requirements, they stipulate exactly what you must have in your premises that is conducive for health requirements. So the other thing now, certificate of acceptability. It's a certificate that says your shop is certified that it is meeting the requirements.
Okay.
And
the health requirements.
For the health requirements. If, for the benefit of your listeners, it is important when you go to the shop, you look for a certificate of acceptability. The shop owner is supposed to display it. So that when you come as a consumer, there is a certificate of acceptability from the city of Cape Town, which is stamped and clear that is from the city of Cape Town, not from anybody else. It's issued by the city of Cape Town Environmental Health.
Okay, perfect. So every business should have this displayed.
Formal businesses, yes.
Formal businesses.
Yes.
So it should be displayed on their premises. And if not, do you have any right to maybe ask them, do you have, before you can maybe buy or eat some food from that place, you know, are you allowed as a normal citizen like myself to go in there and be like, why don't you have this certificate? Are you certified to sell?
I think to answer your question, if you go into a doctor's surgery, you see there's an emblem that indicates that this is a doctor. This is his registration name. So it applies to those premises. That this is for you to be convinced that these premises are meeting health standards. Those certificate of acceptability must be displayed. It depends on you if you want to ask them. It depends on the individual, but others are assertive enough. Do you have this? So that to ensure that you are complying. So it depends on an individual. But with us, we ensure that when we give them to them, that this must be displayed for public to see it.
Okay, perfect, great. I think that's very, very interesting right there. One thing I also wanted to ask about is, you know, I'm sure you have some health practitioners that come back to you and maybe report to you about some of the work they've done. What have been the most common challenges that they face when they go into communities and to these shops? What are some of the challenges that they encounter in trying to ensure these health standards are complied with, especially in relation to Spaza Shops?
Yeah, one of those challenges that is common is the knowledge from the business owners or the people in charge of the premises of the health requirements, what is required from them. They don't have that knowledge that we are trying to inculcate in their mind. Secondly, challenges like accessing those premises. Sometimes you go to certain shops, as you know that we've got shops from other people that are coming from other countries. They don't allow female environmental health practitioners to access their shops, but we have engaged with them to ensure that the female must come and inspect the shop. So our engagement with them that we have done so far, they have understood, and they now understood that. Now they are allowing them. But previously there was some little bit of resistance of not allowing them. But because of our...
And that's based on the lack of an awareness, right?
That's it. So we're creating awareness and we are engaging them so they can understand. So those things are being addressed and then now we start to see them welcoming them. That is accessibility.
Yeah.
And sometimes they want us to make appointments. Sometimes we make appointments, but most of the time you go there unannounced so that you can see whether the premises are in good standard.
Yeah.
Yeah. Then the other thing that comes in mind, language barrier.
Yes.
Language barrier, as I indicated that some of the Spaza shops or the shops are owned by other people from other countries, foreign nationals. Then there's a language barrier. You tell them to do this, but now you find yourself, you are not finding each other. Then you are lost, they are lost in the narrative.
Yes.
However, we always encourage that if there can be a translator to address those particular challenges. And in general, and then also some of them are aggressive.
Yes.
In general, business owners, some of them are aggressive towards...
Do you think that's also because of the fact that maybe they feel unsafe in South Africa? Could that be the reason?
No, I'm not only referring to I'm referring to all the business.
Yeah, all business,
I'm
okay.
not saying
not just migrants, okay.
I'm talking in context in terms of all the businesses.
All business owners,
they've got some resistance when you go there, and they want you to announce when you are coming and all those. So I'm talking to everybody, because we are treating everybody equally in South Africa. In
Perfect.
Cape Town,
yes,
everybody.
Great.
Then the other things that, as I said, they are aggressive.
Can I just touch a bit on the language barrier issue you mentioned? So you mentioned you bring a translator with.
No. We prefer, we don't have translators. We prefer translators because bear in mind there are a lot of languages. Yeah, so we're trying to come up with that concept of translation, but through engaging with the community in terms of them providing that and other things so that we can meet each other. Yeah, I see, because there are a lot of languages.
Okay.
We don't provide translators, but it can be one of the solutions.
Okay. Yeah. Okay, great. Let's
But before that, what I wanted just to say, in general, the sheer and brazen disregard of legislation and the requirements that are there in general.
Yes.
Can
we'll discuss that shortly just after the break. I want us to have proper time to discuss it. Quickly after the break, we'll be talking more about some of the challenges that the City of Cape Town does face when, they do these health inspections. We also look into some of the solutions and some of the work and the amazing work that they've been doing with other partners as well in communities to ensure that every community member as well as business owner is kept safe. So please stay tuned. Don't forget to engage with us on our social media platforms and let us know if you're a business owner or you are, a community member. What are some of the challenges that you face in your community in relation to health standards and, every good that you buy? Do you think those are up to standard? What do you think can be done? What are some of the solutions? How can we work together to ensure that we have food and, goods that are up to standard and that meet the health standards of the City of Cape Town? So please stay tuned. Let us know what you think. Join in on the conversations, Instagram, Twitter, and Facebook. We'll see you after the break. And welcome back. We are still looking into some of the challenges that, are faced by health practitioners and health inspectors when they go into, the Spaza shops and businesses in trying to ensure that the health standards are met. We're still discussing here with Dr. Zimba, and before the ad break, we were talking about a very, very important challenge. But before that, make sure you engage with us on our social media pages. Let us know what your thoughts are on today's topic. What do you think are some of the solutions to this issue? On Instagram, Twitter, as well as Facebook, engage with us. Let us know, because the conversation definitely doesn't end here. Now, Dr. Zimba, you mentioned something before we went to the ad break about the disregard that is there by some business owners on some of the health standards. Can you please touch a bit on that as one of the challenges, of course?
Yes. What will happen is that when environmental health practitioners go to these premises, they identify certain things that needs to be corrected. And then in most instances, you will find that there is a person who is in charge. Then they will leave all those requirements for compliance. And then that particular person needs to take these things to give it to the business owner to put some corrective measures. So those corrective measures are not put in place when you have requested them. And also sometimes when you pick up that they are selling unsound food, then you need to address that. And then from there, you tell them that you need to meet the cold chain in terms of refrigeration and other things, and then cleanliness and other things. So when you come there, you present those things, they don't comply with our requirements and ensure compliance. On its own, then it creates that now certain times we go and do some inspection or we take some samples, and then the sample says this is happening, and then sometimes, because bear in mind they are peace officers, they can seize some of the food or confiscate some of the things when in terms of the laboratory analysis, they are not of good standard, because we ensure that our role is to ensure that people consume food that is sound.
Yes.
Yeah.
Yeah. So now we've seen all these challenges, and you've expanded very beautifully on them. Now, what do you think then can be done? What more do you think can be done? I know you've touched a bit on some of the solutions, but what do you think as, not just the City of Cape Town, but also other organizations? I know we've done some work with you guys as Africa Unite in trying to raise the awareness. We've done orientation sessions, as well as with other departments like the South African Police Services, as well as law enforcement. But what more do you think can be done in order to make sure, that we curb all of these challenges and we work together and we do it in a way that, no one is left feeling victimized or anything like that? So what do you think then are some of the solutions here?
Yeah. As you know that the city is a caring city, and the city is a city of hope.
Yes.
And we encourage people to conduct their business and to ensure economic development.
Yes.
But in the process of doing that, any business that is operational must put health in the center of whatever they are doing. So what is important is to bring together all the relevant stakeholders, as we have done in Mitchell's Plain and Lelethu,
yes,
whereby various organizations, various stakeholders were brought in together and engaged joint sessions, and then we shared information,
yes,
and we conducted inspections together on site and other things to ensure that what is expected of us and what is expected of you.
Yes.
As a result, we have seen people coming. What we've noticed that now there is an increase of cooperation.
Yes, yes.
After the engagement. What is important I'm trying to say is that we need to engage the stakeholders, educate, create awareness involved, because there's nothing important than engagement.
Yes.
And training people about our requirements. And then when we have in Mitchell's Plain and Lelethu session that we held jointly with other stakeholders, various departments like land use was brought in,
yes,
police were brought in, home affairs were brought in, and all the people that law enforcement, they are brought in to ensure that the people are educated. As a result, we have seen some degree of acceptance. What is important is to promote good working relationship, and harmonious way of working together, and ensuring that the health of the public is in the center of whatever we do. So I always encourage those engagement, and then let's find each other. Let's find each other.
Yes,
what are your expectations? Because if you don't know my expectations, how will we ensure that you comply? So it's a process. Education is a process, and awareness is a process. Then we bring in then definitely legislation, legal notices where we had to come up with to ensure compliance. But what you do, complement that with education and health promotion.
Yeah. Perfect. Thank you so much, Dr. Zimba. Just a few last things from my side. One, what can you advise any migrant business owner out there to make sure that they comply? And not just migrants. You mentioned that you work also with South Africans. You work with everyone equally. So what would you advise Spaza Shop owners out there? How can they make sure that they comply? You've spoken about engagement, of course, but on a personal level, what can someone do to make sure that these health standards are adhered to, and that people actually, make sure that everyone is safe in communities?
Yeah. What I advise is to go to our offices and ask pre-consultation before they start a business, or pre-inspections before they start so they can start to know what is expected of them before they embark on the business, and also conduct, and they are given our guidelines, and also when they get these guidelines, they go through them with these guidelines, and then where we have to train them and tell them about the regulations that we are using. For instance, we are using regulation R638 that ensures if you are manufacturing food, you are processing food, you are handling food, you must comply with regulation 638 in your premises. And then they must be told in order for you to comply, you must apply. What must you apply for? And those COAs, and then also the business licenses, you take them through, and then you advise them so that also they can go to any environmental health practitioner's office. They can also go to our clinics or any City of Cape Town office. They will be referred to the environment. Our telephone numbers are available there, and we've got also the environmental health also are on the website of the city, the contact details.
Yes.
You can approach the City of Cape Town, the website, and also there is also the toll-free number, but also there is the verify.coa at capetown.gov.za, and also you can access it through the FFC application .cityofcapetown.gov.za. So
Perfect.
they can be able to be assisted. They must sit there. We are there, trying to help.
Yes.
And we need to work in a harmonious relationship with all business people, irrespective of where they are coming from.
Yes.
We
Definitely.
treat everybody equally.
Definitely. Thank you so much, Dr. Zimba, for joining us. And it was I wish we had more time, really, because I feel like this is very informative. And I'm sure this is part of, as well, your awareness and the work that you do in creating awareness. But this was very informative. And please do not forget, the conversation doesn't end here. Make sure you join in on our social media conversations. On Instagram, we are official_Africa Unite. On Twitter, we are Africa_Unite_ZA. And on Facebook, we are Africa Unite. It has been such a great season, and thank you so much for joining us. We do not stop here. Like I said, make sure you join in and continue to, have these conversations back at home. I wish you all a great 2024, and please do not forget to join in once again on social media conversations and the repeats as well. Don't forget to watch us on the repeats of the show. Thank you so much, and have a lovely 2024. Goodbye.